We are live on Planetary Health First, Mars Next, and it is an amazing day. We were able to have a special guest here, Dr. Claude Pinnock, and he is coming from Cambridge but resides in New York City, and he is leading the charge as Chief Medical Officer at Wider Circle, which everyone needs to hear if they have anyone who's older than 65, probably younger too, with some of the Medicaid dual eligibles that have chronic disease. It's all about helping individuals. He'll get more into that. But let me just tell you a little bit about him. I'm really super excited. He's got a really neat background. And I'm not going to read word for word his bio, but he is super qualified, and he is no stranger to healthcare. He's a veteran with deep clinical strategy and digital experience, really diving deep into the social determinants of health. And he's also been working at Cambridge University in public health. He was at Stanford for a little bit of time, Stanford University School of Medicine. I think we've heard of Stanford. That is and then also Clarify Health Solutions, which another guest of ours was on, really focused on the data analytics. So he was doing product there. And he also was leading the charge at Meta, Facebook, with really helping them with their global strategic work. And that was really during the time driving innovation and the global adoption of vaccines. So I'm really super excited, Claude, that we have you here. Would you help a little bit fill in the gaps just to give us a little more introduction about yourself? So glad you're here today.
Yeah, thanks for having me. I appreciate the time. No, you did a pretty good summary. I mean, I left full-time clinical practice over a decade ago now, which is aging me, and have done, as you mentioned, a variety of things. Probably one of the more rewarding jobs I've had has been leading value-based care initiatives. That was straight after I left full-time clinical practice, before anyone really even knew what value-based care was. And then a lot of the work we did at Facebook was super rewarding as well, and had just a colossal reach in terms of the numbers of lives we were trying to affect. And then my favorite job, which is biased right now, is at Wider Circle. I often say if this program existed back home in the UK, I would prescribe it to my own mum. And I'm looking forward to talking more about that and anything else you want to chat about. So, yeah.
Great. Well, let's just get started. A picture is worth 1,000 words. So I'd love to just share real quick about Wider Circle. So just, if you could, audience, give us about a little more, almost 2 minutes and change.
The mission of Wider Circle is to connect neighbors for better health.
Our well-being, our happiness, everything is just linked to our community and to our neighborhood.
Everyone needs somebody to lean on. And that's really what joining Wider Circle is, an invitation to be part of.
We read over 600 publications that looked at the science. Being together in a community is critical to our health.
Before I joined Wider Circle, I was home every day, just about, doing not much of anything. Then we started doing activities, and then I got myself moving, and I got off the couch. We just had a great time.
We found some good friends. Being in the group is just all the time, it's happy. We have a lot of fun together.
Mi esposa me invitó a que viniéramos aquí juntos, convivimos y me gustó, y pues aquí estamos ahora ayudando siempre.
It gives me something to do, get up, do yoga, and get the bones working. It's pretty good. I like that.
Neighborhoods in which we've been operating for a while look different. Neighbors know one another more, say good morning to one another. If there's a senior living on the block, he's not alone on Thanksgiving. People knock on his door, bring in turkey, say, how are you?
I got sick, and I got sick with COVID, and my entire family in December. Members left food outside my house, and it was the most wonderful 2 weeks that we had, because the food was delicious. So that was an amazing experience that we had. How much love there is in the community now, and I feel the same way for them.
Cardiologist came to speak to us. An ophthalmologist came to speak to us. We even had a meeting on estate planning. So you're learning and having fun at the same time.
No le damos chance a la vejez ni a la depresión. porque vamos combatiendo eso con la alegría de compartir todos.
I see members' faces smiling, getting healthier, socializing, and that brings me happiness.
Creo yo que no puede decir que no cuando se le va a explicar, a platicar lo contento y la unificación que hemos tenido con todo el grupo.
If you have somebody that's kind of hesitant to join, basically I tell them, just come to a couple of events and just see how much fun we have.
Nos mantenemos jóvenes, always happy, always young.
Well, this is awesome. So, Claude, take it away. No better. You guys just saw a little bit about Wider Circle. So glad you're here. So, what is Wider Circle, and what are you guys doing?
Yeah, no, thanks for asking that. So, we've been around for about 8 years, but it was really only about 3-4 years ago that we went from being sort of a single state company to being a multi-state company. I believe we're in 12 states today. And our whole mission is to connect neighbors for better health. But what does that actually mean? How are we actually doing that? I like to sort of break down our elevator pitch into sort of 3 parts. The first is what we do is typically try and find the members that the plans, the risk-bearing providers can't access. I'm talking about the Medicare Advantage patient who's got diabetes, hasn't seen a PCP in 5 years, or the Medicaid member who's couch surfing, has a burner phone, and the plan doesn't even know where they actually are. And we find these members through multimodal outreach, all the way down to feet on the street canvassing and door knocking campaigns. And once we, found those members, we build community around them. And this is probably where our technology comes into play. So we leverage some proprietary algorithms we have that use claims data to essentially create social networks of individuals such that they'd be extremely likely to form trusted relationships and friendships if they met organically in real life. We're just putting a slight thumb on the scale by putting together certain groups of folks. And then 3, we're just building trust initially. That's all the program is doing, is starting off by building trust. And we do that by running those groups with our hyperlocal, culturally competent community engagement liaisons. They're essentially community health workers. They follow the 3C national curriculum for community health workers. They have that shared lived experience that goes beyond just speaking the language. They've actually grown up in the neighborhoods. They know the local resources. They get it in a way that you and I wouldn't. And like I mentioned, just building trust to begin with. And then once that trust is established amongst the neighbors, amongst our community team and them, you can point it in all sorts of really cool directions. It doesn't have to be just cost or quality or enroll in a program. It can be whatever the member needs and whatever the community needs, so that folks can have that network to support one another a longer term. And, I sort of summarize this with a slightly cheeky analogy, which is, I've probably been trying to give my parents medical advice for the last couple of decades, and I can count on one hand how many times they've just listened to me. But if a friend or a neighbor says something, it's the gospel. So we're really just leveraging that kind of psychology of influence, that perspective to get folks to engage in a way that they normally wouldn't. And it's been really successful so far. And worth mentioning, we work in Medicare Advantage, Medicaid, and Duals lines of businesses. We don't currently do anything in the commercial space, but that's the elevator pitch.
Yeah, Claude, I love that. And I love your humility as a clinician, doctor, because my gosh, you had all this knowledge and you're gaining this knowledge as we speak too, right? And the parents just, they don't want to receive it. And it's that power of what you're telling me, what the Wider Circle is. It's the peer-to-peer. It's like someone who's been in your feet, like the diabetes patient or the caregiver of someone with diabetes is like, look, this really impacted my husband, my spouse, and bam. And you've been like, I've been telling you about A1C or this, whatever. And so anyway, I love how you put that. And so anyway.
Yeah, it's so true. And we also try and make sure to pepper in like what we call positive deviants in the groups. So like we'll have, if we had a cohort of diabetes folks, we'll have folks who are like doing all the right stuff in there as well, because they can be really powerful at speaking to the other members rather than it being sort of someone telling them what to do. Having a trusted friend or a neighbor saying, hey, look, I also have diabetes. You should really check this out, because otherwise you could, like, you know, your kidneys could get worse, or you might not be able to walk. You know, that kind of ability to influence is something really special and unique that I think is often missed upon when we're trying to do basic health education and health promotion in the healthcare system. And we saw this during the pandemic as well. People listen to people who are like them. They don't listen to people who look like you and me if they're not looking like you and I. So you got to be mindful of those cultural norms.
I love what you say about that. That's unfortunate, but so true. And so when you design the community care coaches, and I think you guys use the term facilitator, which I think is kind of good, because it's kind of, I think it's accessible too, because it looks like the little research I've done, there's people that are everyday people that might not necessarily have a healthcare background that make the best facilitators, correct? They don't come in with their own bias or preconceived notions.
Exactly. They are able to meet members where they're at versus coming in with like an intellectual hubris, which is kind of what you were alluding to, and that's really powerful. And the other thing that we're able to do as well, that's probably as a segue from that, is we in addition to our facilitators, we've got thousands of what we call ambassadors. So these are our own members, like a volunteer workforce, who like help with scaling from an operations perspective, not from a facilitation perspective, but like how we can continue to run these groups, and they support the smooth running of those and act as those positive deviants I was mentioning. So identifying those ambassadors and leveraging that community to create a network and a social movement has been really important to our scalability as well.
I bet you find, I know there's some really powerful social data on that, scientific data on those who are volunteering, those who are affiliated with groups do much better. I wonder if you already have little data on the ambassadors, the ones that are higher or more involved are actually showing better improved outcomes. I don't know.
It's a great question. I don't think we actually have done a cut of evaluation of ambassadors, but I know what I'll be asking my data team after this call, whether we can have a look at that. What we have been able to do, if it's worth me going into, I'm happy to, is just sort of outline to you how we've shown return on investment. Yeah,
please.
One of the really cool things we're able to do, because we have access to all this longitudinal data, is conduct pretty rigorous propensity matched cohort studies. And what I mean by that, just to break that down, is you'll have one group of members who've never even heard of Wider Circle, and we'll be able to look at their pre and post values for X, whatever X may be, utilization, quality metric A, and measure that over at least a period of a year. And then we'll have another group of members who are engaged with Wider Circle and be able to look at their pre and post values for the same metric and do a difference of differences between the two groups. But Claude, you'd say the folks who have engaged with Wider Circle are systematically different to the folks who haven't. This is a selection bias, and you'd be exactly right. And that's where this propensity matching piece comes in. We're actually doing a difference of differences between pairs of members between those two groups, where the pairs are matched on things like baseline demographics, clinical, social factors, baseline utilization costs, and it's called a very narrow caliper when you do a really good match. And this is to do an apples to apples comparison, so that you remove as much of that selection bias as possible. And we were so confident about this that we actually got Milliman in to do a review of our methodology, and they gave us sort of the go sign, if you will, and said that we were consistent with their typical practices. So we're really proud of the fact that we were actuarially validated. And then we've done a bunch of studies after that, which have actually shown really solid ROI. We've even been published in the peer review literature showing sort of quality improvement and lower costs through this. So it's not just kumbaya, it's kumbaya meets calculators, right?
Wow, that's really powerful. And usually that data, is the fact that you've done such a heavily analysis. It sounds like you have, evolved with these programs, because I know a little bit that I've been in healthcare, like the silver sneakers through Humana and UHC, they, all these great things that where they get, they know people that exercise, it does better. But what you're really doing is you're taking these programs and then you're doing the data scientists, all these analysis, and really hyper taking it to like healthcare 3.0, if you would, right? I mean, so, I mean, it sounds like that's some of your competitive advantage, that you're really diving deep on the data. So I know you're a clinician. I'm sorry I'm talking so long, but I'm getting to the landing. Is that it sounds like not only are you a clinician, but you're really very into the deep science, data science practice yourself, or at least the wider circle, kind of their moat, what makes you guys special, you know? Is that?
Yeah, I'm too humble to say I am, but I certainly have a wonderful team that supports all of that stuff. We've got a wonderful technology division and data scientists on our back end who are able to do this unique grouping, and also able to sort of test these hypotheses as I noodle on them and sort of think about how we can, as you say, differentiate ourselves by actually showing in peer-reviewed literature through rigorous studies, hey, this isn't just like another vendor solution. This actually makes a difference, and if you invest in us, you get your money back, and most importantly, you do great things for your members, which is ultimately why we're all here. So yeah, we're really proud of that part. One thing I always say as well that I forgot to mention at the top is, we're in a world right now where there's an app for everything. There's a widget for everything. And one of the things I actually say to folks when I pitch Wider Circle is, if you want another app, that's not us. Like, we are a people first solution. We're supported by some awesome technology on the back end that allows us to scale and do some of the things you mentioned. But ultimately, we're about people. And I think that's our other differentiator, to be honest, is like, I think so many people have forgotten that healthcare is about people, and we're putting our people up first. And it's a people first solution. And I think that's also what makes us really powerful, and speaks to this bigger vision of trying to restore the community fabric that I've observed. And maybe this is just because I'm getting older, falling apart. I'm sure it's always been how it is, but it's just how it is as you age, isn't it? You think things have gone worse. So we're on this mission to restore the community fabric overall as well.
Yeah, I like that. And I like that with what you mentioned, and you obviously highlighted with the video that I shared earlier, just how cultural sensitive. Obviously, it's probably a lot in the California area with this, this Spanish speaking population. There's no way that like you have to have someone live from your journey that's like you to make an important impact. So I like that. That's how you're wired and aligned, and using that, and you have the data to verify that. What have been some of the things that you found, or Wider Circles found, that you guys were dead wrong?
Okay, so Medicaid. When we first went into Medicaid, and this was in Detroit, Michigan, so we did what I've sort of outlined. We did the data analysis, we created the social networks, we hired those hyper-local culturally competent facilitators, scheduled events, and it was rough to begin with. And what we found with the Medicaid population is the need to build trust, the dynamic of that. You can't take the more lackadaisical senior focused route that we've been using. You have to really narrow in on something that's tangible for those folks immediately. And so what we actually did was, off the bat, we would do a social drivers of health screen and actually help them with something and walk the walk instead of just talking the talk off the bat. And I think that population really needs to hear that, because a lot of folks often will say, oh, it's a transactional population. And I actually have real issue with that statement, because if I'm asking a member of a family to come out to one of our events or to join one of our virtual events for an hour, that's an hour of work. That's food on the table for folks who are struggling to survive. So I better make sure that what we have to offer is damn worth their time. So we reoriented the program to tackle SDOH first, and that accelerated the trust building. And in addition to mixing in a bit more canvassing, and we got fantastic engagement as a result of it. So modifying the program slightly to a better suit the Medicaid population was definitely a learning for us, but has led to much higher engagement. And some of the results I mentioned in peer review are in a Medicaid population. So some of our best results are in a population that I think needs it the most, excuse me. The other thing is the value drivers are different for different populations. I think for seniors as well as chronic conditions, it's a lot more about this loneliness epidemic. But right now, to be blunt, and this is disappointing, while there's a lot of traction around loneliness, and you've got the Surgeon General's recent comments about how it's as bad as smoking, the money's not flowing there yet. Like the financial incentives aren't aligned to tackle loneliness. So it's still a nice to have. And, you know, my cynical viewpoint is that until the money and the policy changes to do that, not much will, you know, there's some progress, but it's always going to be fighting against the tide. Yeah. I'm not sure what the point I was making there was.
No. You totally made a good point. You talked about the trust, you meeting where they're at in Detroit, where you really had to, you know, basically figure out that hour of their time. You know, they're giving up work. You know, how can you really give them first and figure out what they need? And then you kind of moved into some other drivers like the social isolation, which, you know, it sounds like this whole thing needs to be looked at holistically. You know, I have a daughter who I bet you if she triggers isolation at 14 just as much as my mom, you know what I'm saying? And I think there's data on that, and argue with me all day if you want, or just let's discuss. But I think we're more and more, because of social media and more of the way the community has been, you know, I think we're all at risk of being isolated. Now, how do we solve that? You know, that's a need, you know, and I think so.
Yeah, you're not going to get any controversy from me there. I agree. I think this spans all age groups, and that lack of community can be devastating. And, you know, speaking from personal experience, when I first moved to the US, you know, picked up my bags, having lived in the place I was born for, you know, the first sort of 3 decades of my life, I had no community when I first moved to the US, and the effects of that on my own sort of personal health were not awesome, you know, and building community is so important for all age groups. And I also think of it as part of, like, and this is something we've been noodling on at Wider Circle, is like, how do we position ourselves as a family program, you know, so it doesn't just be, it's not just for elderly or middle of the past or even younger. It's like, how do we like encourage multi-generations to sort of engage in something like this and create sort of a cohesive family program as part of that, which is a key part of the community fabric as well. It's the smallest community you have is your family, right? So helping with that is important. Yeah,
I think that's so important. Often when there's, you know, you get into counseling, you know, it might be for one member. It's really everyone that needs to be, you know, it's these little areas, these little pockets. How can you create nodes or greater connectivity or greater flow? And man, I think that would be really exciting what you're doing with the intergenerational opportunity with those knowledge flows, those trusts. Love to see what you guys, I'm sure you guys are working on stuff. I think that could be really exciting, you know. Well, I think the other thing is when I think about like the low-hanging challenge with, if you're doing Medicaid population, the mental health epidemic. So are there any areas or programs that you're finding within that you guys have found that are like, or like, let's do mental health, we could do that, but also like what you're finding from your members, like the greatest needs and how you guys are trying to match that?
Yeah, so just to make sure I'm understanding your question, are you sort of trying to ask what is the signal we're getting from our members in terms of the greatest needs?
Yeah. First that, and then let's just go second to that. Then I want to just cover mental health in general within your wider circle.
Yeah, so I think the way we approach like signal from members is like, well, what do you need? We don't try and like prescribe, hey, we're going to sort out X for you. It's more a case of like, like I mentioned earlier, meet the member where they are and understand what's important to them. And we'll have worked with our partners at the plans and providers to like figure out what some of the macro level priorities are, and we'll have a lens to that. But because the key to the program is building that trust initially, what we'll open the salvo with like, well, what do you need? How can we help with that? And then we'll segue into the more perhaps macro level issue, whether that's like enrolling them in certain programs, or there's an issue across diabetes or mental health, like you mentioned. So we try and keep the program almost agnostic from those specific things to begin with, and then we narrow in afterwards based on what the members' needs are. Does that make sense? Some folks,
and I guess that's the delicate challenge, Claude, to service the enterprise, the payer, right? With no joke, the payer, right? You're who's the payer, the buyer of it versus your customer, right? Or I guess that's the challenge. What's that delicate balance to creating the value and not misaligning that? That to me sounds like a sometimes not as, and then to be innovative. It's like, Steve Jobs, you guys are innovative. It's like, your customers, if you gave the customers what they thought they wanted to be a faster horse. So I imagine how do you balance that?
Yeah, I mean, obviously there's, we show them the evidence is always helpful, and it's great that we've got this body of evidence. But we approach these things as a conversation where they'll have their priorities and be like, "This is great, thank you for this." What we're going to do is we're going to look at your claims data, and we're going to identify the social value and the healthcare value and where the deltas are, and where the pockets of networks and communities we can create are, and what that looks like. And we're going to bring it back to you, and let's have a conversation. And if we start the partnership up that way, sorry, excuse my dog.
No, that's dogs are welcome, Claude. You
well,
keep
in that case, here's a brief cameo. So if we establish a partnership that way, it tends to go pretty well, thus it being a more transactional thing. It helps that we've been actuarially validated. Yes, it helps that we've got solid research. It helps that we're in lots of the markets that plans are talking to us about, and it helps that there's more of a political will towards this stuff now than there was 7-8 years ago when Wider Circle started. But that's generally how we thread that needle, that tension, if you will. It's been pretty, it's been very successful, that approach so far.
Well, how in the world did they find you, Claude? I feel like you're the perfect person for the chief medical officer for Wider Circle. How did that come about?
How did Wider Circle recruit me? I actually was headhunted by a recruiter, and I'd never heard of Wider Circle, I'll be honest about that. And I was working at Facebook at the time, or Meta as it's now known, and was headhunted. And the more I met Moshe, who's now our chairperson of the board, and Darren, who's our CEO, and I was like, these are good people, and I like the mission. And I met the board, and I met some other folks and interviewed, and it just like the mission really resonated. And the thing I love about my job is I've got like 6 jobs, and that keeps me very busy. It's a lot of variety, but I love that variety. If I was just doing the very narrow focus every day, 5 days a week, 7 days a week, whatever it is, like that makes me bored. So I really like that variety, and that part plus what we were actually doing to help members really resonated with me. So it was an easy choice to make.
Cool. Well, that's awesome. Tell me what those 6 things are. This isn't you said them. I'm not, this isn't, if you get 5 of them.
Like no. I lead a lot of our strategy, especially as it comes towards like service design and new model design. I lead our research work. I led a lot of business development work and support sales and marketing. And then the 6th job is, I think, the most important. Obviously, you've got to bring in the cash to keep everyone employed, but this is directly related, which is culture and community amongst our own Wider Circle staff, and being an ambassador of the leadership team to the rest of the organization. We're over 400, I believe now. The number changes all the time because we're expanding so much, and maintaining our identity through that large scale expansion and being visible and accessible as a leader and giving like a very clear vision and making folks feel like they're on part of that journey and they understand how their day-to-day work impacts the bigger picture is super, super important. And I see myself as being an ambassador of that as well. So that's job number 6. I don't know how you'd summarize that.
Man, you nailed it out of the park. And all I'm thinking, Claude, is we got to have you more talking about Wider Circle. And I think what you say is just it's people want to be part of organizations like that. And when I was reading Jeff Bezos' book, it's missional driven. He'd rather have missional driven. Those are the ones that end up returning ROI and making more money. Typically, if you're in for the quick buck, you don't create a moat, you don't create value, you don't create culture, you don't create people that want to just put all their sweat, and people want to be part of something that's big. And it sounds like those 6 things, I mean, sign me up. I want to learn more about what you guys are doing. So I'm sure other people are going to feel the same way. They want to learn more about it. They want to. Anyway, kind of now trying to. I guess the other thing that I'm curious about is what do you see the biggest thing that you're hoping this year with Wider Circle? Do you have anything in the next year or 2 years? And maybe you can't say, it may be NDAs, it might be something that you're rolling out.
Yeah, so there's a couple of things. So I'm going to do sort of a broader answer and then a very specific answer for me. So more broader, like we want to grow. We want to become salt and pepper. Like we want to be so ubiquitous, so well known in this space that like whenever people think of community fabric, whenever they think of like neighbors, they think Wider Circle. And that only happens with more growth, more members, and a higher percentage of members being engaged in populations we serve, taking us from like 15-20% engagement to 30-40% engagement. And we've got initiatives working on all of that. And I'm really excited to see how the service design and the pieces that are supporting that is going to bear fruit. So, growth is for a company at our stage is always important, but not growth at loss of identity. And that's something that I really appreciate from my leadership, from my CEO, Darren, is that I feel like we have a really solid identity and we don't grow at the expense of our identity. Like we're not all of a sudden like, hey, we're now, I don't know, a vendor for something else, like monitors. We're not pivoting industry all of a sudden.
Yeah, you're not going to do work. You're not going to do workflow staffing solving.
Yeah, or like become like an EHR or something all of a sudden. So I really, that which is always good to have like that focus, right? The other thing that's really exciting, that's public domain, is we recently signed a joint venture with Apollo Medical Inc., which is a large provider-based organization in California. And that's to deliver enhanced care management services. So enhanced care management, because not everyone will know what this is. It's a Medi-Cal initiative. It's really basically a posh word for whole person-centered care for high need, high cost populations, folks who are high utilizers, at risk at long-term care, homeless, etc. And Wider Circle is partnering with Apollo Med on that to really enable what I'll call value-based care in Medicaid, right? We're doing all the things we do. We're doing the engagement, the identification, the SDOH, the building of the community, and Apollo Med's doing all the stuff they're really good at. They've got their network of providers, their licensed care managers, and their nurses and stuff to like really be point contacts and have a holistic and rock solid partnership with the member to deliver the best care for them. And together, I think we create this Voltron of awesomeness that differentiates us from other folks. Now that's in California right now, and I'm really excited for the expansion of that over the next year as we enroll more members in that and get certified with more plans to become enhanced care management providers. But the other thing that makes me excited about it is taking the lessons we learned from that and applying it elsewhere. So there's like a CMS initiative called Making Care Primary, or I think it's called Making Care Primary, which is similar. There's recent 1115 waivers, like the one released in New York, which basically has enhanced care management under a different name in it. So this is clearly something that's expanding, and it's all about value-based care enablement in the Medicaid space. And I'm excited to take that model and grow it over the following years in different states as it becomes a viable opportunity for us as an organization. This also leads to something that I mentioned earlier, which is like, if you want things to happen, the policy has to catch up. And this is an area where I feel like we're well suited and policy winds are favorable. They're tailwinds right now. So this is something I'm really interested on for us. So that's one. And then the other one that I've been working on that I'm really excited about is community health workers. So our community facilitators are community health workers. In fact, we're actually changing our Wider Circle University to have a 100% overlap with the 3C national curriculum so that we can certify our staff as community health workers. And recent legislation in a couple of different states, you can now actually get reimbursed as a CHW by Medicaid. There's certain CPT codes that are allowing you to get reimbursed. So we can actually be a provider for our services, and that can offset some of the costs or even potentially cover it all, depending on actuarial flexibility. And different states, different strokes, because that's the Wild West in some states, and other states a lot more rigorous. But I'm really excited to watch the CHW landscape evolve and for us to fill that space, because our services can be paid for via this mechanism, and that will allow us to serve more members. And this is just a classic moment of, hey, the right things have aligned in terms of economic policy and our model that could allow us to serve a lot more members. So I'm excited to sort of follow that and see how it can help us expand even more over the next few years.
So that's awesome. So where are you at with a capital raise? Are you Series A, Series B? Where it seems like that's going to.
Series B was done. Oh, I should know this off the top of my head. I think it was
I'm
2.5
sorry.
years ago. No, you're
Okay.
fine. So I think it was back in October, November, maybe of before I joined of 2021. If that's
Okay.
right.
Okay.
So yeah, post Series B. We're actually so that's where we are as an organization, and doing really well with that.
Okay, so I guess are you in the and obviously you're not, you're the chief medical officer, of course, culture and whatnot. You are involved a little, but obviously you're driving other stuff. But I imagine, so if you're in Series, you've completed that, so there's a Series C, and all these great things are going to require some capital. So I imagine that's other conversations going on as we speak in different ways too.
Yeah. I mean, we're always thinking about how to expand strategically. I think that's the key thing. As an organization, like what's going to enable us to have growth and be strategic, and those conversations are happening. There's nothing firm yet to report.
Yeah. Well, Claude, one thing that I really thought was cool that you just said, when I heard what you said, the way you were doing it really methodically, really smart, really delivering the care that our healthcare needs to see with value-based care, is with Apollo Med. What that I'm imagining is a lot of what the intention was with PACE, with a lot of the facility avoidance, or the high utilization, is just get the smarter care, utilizing the community health workers. If so-and-so is driving up 250,000 in diabetes claims, well, geez, they need a refrigerator. I mean, it's these sort of things. The refrigerator isn't working, they're not getting their insulin, or they don't have a car. I mean, all those sort of things. I imagine it's those sort of things that just sadly enough are not happening in our fee-for-based model. So,
so true. And you can't pay for that. Like, you can't, as a physician, be like, I prescribe you a refrigerator. But thankfully, the policies and stuff are changing, and the recognition of SDOH is changing, such that there are now routes to tackle this stuff, because it's 50% to 80% of all outcomes are affected by stuff like this. So.
Well, Claude, I'm so glad you came on today, and really, I couldn't imagine a better cast, a pulse of what Wider Circle's doing. I feel like I have learned so much today, and you've articulated so many different elements of what you are and what you guys are doing, the vision. And I really am excited that they, some good positive thing comes out of recruiting those headhunters. So whoever that headhunter was, they found you, and I'm so glad that also your teammate said, hey, Mike, I think this is the guy that you want to have on your show. So I really appreciate them having, getting you on today and having you on. It's been great.
Yeah, I appreciate that. And, I always want to make sure I emphasize that I'm only as great as the shoulders of the people around me. So I've got a wonderful team around me. We've got a wonderful, all the way down to our shop floor, like really wonderful people, really passionate about what they do. And ultimately they're the heart of our organization. I'm just some British guy who happened to end up in this org. So I try and take a more
all right,
approach, but I appreciate the kind words. Thank you.
No, this has been good. And anything last minute thought that as we wrap up and call it our day, is there anything else that you'd like to share with our audience?
Yeah, one thing. Reach out to a neighbor or reach out to a friend. It's so easy in our lives to just stay insular and you mentioned some of this stuff earlier, Michael, about how we've become more solitary as a population. Like it's hard to take that first step, and you may not know what's going on with someone else, and it may be much harder for them to take that first step. So if there's someone who looks isolated, or even if you're isolated, reach out. It's very easy for me to say that. Just reach out. It can be really hard, and different personalities struggle with this stuff. But find a way, if you can, to try and reach out and build community. I think we're all better as a civilization when we're all talking to one another versus when we're in our silos screaming at each other. So more talking, more reaching out, and figuring out what our shared values are, I think is just a good thing for the world.
Wow. I love it. More listening and connecting, reaching out. You heard it today from Claude, Chief Medical Officer, Wider Circle. Everyone, thanks so much for showing up and listening to Planetary Health First, Mars Next. And may you have a great day. And we look forward to more